Yeah, I wasn't gonna do makeup, but I look sleepy, so let's add a little bit of makeup. Oh my gosh. I was talking to my friends about what the Mayo Clinic in Minnesota did. Insane. So, 3 of their locations are saying that they no longer need respiratory therapists at night. Not saying that a nurse can't manage a ventilator, because obviously they can, but trying to manage a ventilator and manage a CRT machine, and unfortunately with your patient codes, like, you gotta take them off the vent, bag the patient, but then, like, who's gonna push drugs? Like, that is so much responsibility. And if I was a nurse, I'd be like, if you want me to manage a ventilator and do my job as a nurse, are you gonna pay me more? Are you gonna pay me for doing a job of 2 people? If not, then that's insane, because what if something happens to that patient? What if they have to do emergency trach at the bedside? Like, anything could happen. Are you going to protect my license? That's insane. Nurses already do a lot. I have like 10 nurses in my family, which is why I chose not to be a nurse, because they tell me some horror stories. I also feel like they have to deal with the doctor more, and not saying that all doctors are mean, but some of them can have a little attitude when you call them in the night and ask them questions or ask them to put orders in. I'm putting this on. So I typically don't like dealing with that, you know? Yes, a respiratory therapist, I might have like 20 patients, and the nurse might have like 2 to 5 patients. That's fine, whatever. As long as I don't have to do what they do, no thank you. Because I can't imagine like trying to go to CT or MRI with all those pumps. Like, that gives me anxiety. But like I said, to not have a respiratory therapist at night is insane. Anything could happen. I'm like, are you gonna hire more nurses then? But I just don't see that working out too well for them. I think this is absolutely going to backfire, and people are gonna get mad. Respectfully, as they should, because it's just not fair. It's not safe. If I was a patient and I found out that they didn't have a respiratory therapist at night, I'd be like, yeah, I need to transfer out of this hospital, because if something happens, am I gonna be okay? Are they going to be able to not only manage the vent, but manage my airway, you know? So that's insane. Shout out to other nurses. I feel bad for them, because nurses go through a lot. Not saying as a respiratory therapist, you don't go through stuff, but they go through a lot of things as well, and it's just not fair. I feel like a lot of the nurses are underpaid and overworked, and I see it a lot. I really do. I think that's why a lot of the nurses and I are such good friends in the ICU, because we have to help each other out. It's just a lot of work, and it takes a team. You can't do all that by yourself. So what they're doing at the Mayo Clinic is insane, and I hope they don't start like doing that in other states. That is going to be a disaster. But yeah, that's what everyone's been talking about lately. Prayers go out to them. Really do. Good luck.